Good afternoon. Today I'd like to provide an update on the vaccine rollout and how it has picked up pace in the last couple of days. But first, I want to say thank you. Thank you to all those Albertans aged 40 and older who've already signed up and showed up to get the Astrazeneca vaccine. I'm encouraged to see much more activity at the walk-in sites and higher number of appointment bookings. I myself booked Astrazeneca, the appointment online at 8 a.m. this morning, and I have to say I was impressed at how easy it was. I was put into the online queue. I got real-time updates on how many people were ahead of me and how long my wait was, which I think was about 7 minutes. And at the end, I filled out a simple form and got to pick my time, which will be on Thursday. So thank you to the folks at AHS for creating such a convenient process for everyone. This vaccine works. Astrazeneca has been shown to reduce infection by 60 to 70% and to reduce severe outcomes like hospitalization by 80%. It's also safe. The risks of adverse reactions are minuscule compared to the risks of COVID-19. Anyone infected with COVID-19 is much more likely to experience a blood clot from COVID than they are from the Astrazeneca vaccine. This is an interesting fact. I just learned earlier this week that about 1 in 4 people hospitalized with COVID get blood clots, versus a tiny, tiny fraction of people who've taken, I think the last count, 700,000 Canadians with AstraZeneca with fewer than 5 confirmed cases of blood clots that I'm aware of. So again, the risks associated with COVID are massively higher. These are new vaccines, and we're being smart and safe. We've adjusted our approach based on the best evidence available, and we'll keep doing so. Just last week, Health Canada released a safety review affirming the vaccine will remain licensed for anyone age 18 and older. Yesterday, we announced that Alberta is lowering the eligibility for AstraZeneca to anyone born in 1981 or earlier. With COVID-19 cases at high levels throughout the province, we want as many folks as possible to be able to choose the protection that this vaccine offers. Bookings are now available, and so far the response has been amazing. As of last night, more than 107,000 doses of AstraZeneca had been administered in total, and we have about 70,000 appointments already booked for the next 10 days, and that's going up by the minute. That includes 27,000 bookings that were made today alone so far. And that is more uptake in one day than in all of last week. So well done to everybody who is participating. However, we only have about 160,000 doses of AstraZeneca remaining right now, and we don't know when our next shipment will come in. As you may have heard, the Indian government has temporarily banned export shipments. So once again, we're being affected by vaccine nationalism. So if you're over the age of 40, I urge you to take advantage of this opportunity before the supply runs out. As these numbers indicate, Alberta's administration of AstraZeneca is heading in the right direction. The response of my fellow Gen Xers has been amazing, and I know that bookings will only gain speed in the coming days. But a word of caution, as much as we'd like to believe that the jab gives us a superpower, please remember that it takes a couple of weeks for the vaccine to work its magic, and then we still have to get the second dose when it's available to get the full protective effect. So that first dose is not a license by any means to ignore or go lax on public health guidelines. We still have to, all of us, keep our guard up, and we're counting on Albertans to do that. We now have administered more than 1.1 million doses of the Pfizer, Moderna, and AstraZeneca vaccines all in. Roughly 1 in 4 Albertans over the age of 16 have now received a first dose of vaccine. What's more, we're providing real protection to those who are most vulnerable to being hospitalized or even dying from this virus. More than 82% of Albertans over the age of 75 have gotten the vaccine. We're concerned about that 18% of those seniors who are not yet vaccinated. So if you know of a senior in that category who hasn't yet been vaccinated, please reach out and help them out. They might be folks who are stranded at home. They may not have transportation. They may have cognitive impairment and not be aware of the program, but Alberta Health Services has a special program to reach out to those seniors who have not yet been vaccinated. Very important that we get to them. Almost 73% of people between the ages of 65 and 74 have now gotten the vaccine. And about half of those between 60 and 64 years of age now have at least one dose. These aren't just numbers. These are people who are now more protected and less likely to end up suffering from this virus. Of course, nothing is easy with COVID, and we continue to experience setbacks. Just last week, we learned that incoming shipments of Moderna would be cut almost in half, meaning almost 64,000 fewer doses, and those would likely be delayed until the end of the month or early May. As I mentioned, future doses of the Covishield Astrazeneca have also now been put on hold now that India's government is putting a halt on vaccine exports. The Government of Canada has promised to make this up with more Pfizer vaccines arriving at some point in May, which is promising, but timing really is critical. Every delay and every cut in doses means fewer vaccines going out to pharmacies and clinics, and fewer doses getting into the arms of Albertans right now as we battle the third wave. However, the response to AstraZeneca that we've seen in the last couple of days is proof that Albertans won't stop. We won't let setbacks slow us down. We have capacity to administer more than 300,000 doses a week, and we'll keep expanding that. In fact, our stretch target is well over 400,000 a week. AHS will be adding additional walk-in clinics to every zone for those eligible Albertans who are interested in receiving the AstraZeneca vaccine. And beginning tomorrow, walk-in clinics in Lethbridge, Camrose, Red Deer, Grand Prairie, and Fort McMurray will open, with additional AHS walk-in clinics opening in Brooks and Medicine Hat this coming Friday. We also continue expanding our rollout of the Pfizer and Moderna vaccines. More than 1,300 pharmacies across the province are now offering vaccines, with more coming online as supply grows. The first physician clinics have started offering vaccines this week, with hundreds more potentially joining once the pilot is complete. We also expect to receive our first shipments of the Janssen vaccine produced by Johnson & Johnson in early May, which will provide more fuel in the race between vaccines and variants. So despite delays and disappointments, our rollout keeps gaining steam. We've promised to offer every adult a first dose by June 30th, as long as supply keeps coming in, and we will keep that promise if that supply shows up. 2.3 million Albertans are now eligible for their shot. If you're eligible and have not yet booked your appointment, please do it now. And combined with carefully following public health measures, we can and must control the spread so that we can safely start getting back to normal and enjoying a great Alberta summer. Thank you, and with that, I will invite Dr. Hinshaw to provide today's COVID-19 update, and then we'll take your questions.
Thank you, Premier, and good afternoon, everyone. Turning to today's numbers. Over the last 24 hours, we have identified 1,345 new cases of COVID-19 and completed about 13,100 tests. We have now identified 816 additional cases of variants of concern in the last 24 hours. Variants currently represent about 57% of our active cases. In Alberta, the B117 strain is now the dominant strain, meaning transmission is much easier and can happen faster than ever before. We are also seeing growth of P1 cases with community transmission in many parts of the province. Our positivity rate currently stands at 10.4%. There are now active alerts or outbreaks in 567 schools, which represents 23% of all schools in the province. Yesterday, Fort McMurray Public and Catholic school boards moved grades 7 to 12 online until April 30th. To complement the switch to online learning, all extracurricular, youth sport, recreational, and performance activities for those ages are now required to either take place outdoors or be paused in Fort McMurray for the same 2-week period. I would like to remind all Albertans that it is important that we all continue to follow public health measures inside and outside of the classroom. Hospitalizations continue to rise. There are now 476 people in hospital being treated for COVID-19, including 105 in the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. I extend my condolences to their loved ones and to anyone who is grieving today. Each death is a loss for our province and a reminder of the continued importance of containing this virus. I have heard some questions about the timing of second doses for vaccines, so I want to clear up any confusion. Due to limited supply, as you know, we extended the interval between the first and second doses for all vaccines to a maximum of 16 weeks. However, once we finish offering first doses to all Albertans 16 and over, we will start second doses as soon as our supply allows. This will likely be in later June, based on our current supply estimates. So if you have had a first dose, please do not yet call your pharmacy or AHS to book your second dose. It will take a few more months to get enough supply for both first doses for everyone and to begin second doses. As more doses arrive in the coming months, we will look to shorten this interval whenever possible, but that will likely not be until later in the year. There has also been some confusion about the interval for Astrazeneca vaccine. As I said a few weeks ago that we would be using a 12-week interval between first and second doses, depending on the supply. The reason for this is that clinical trials for Astrazeneca showed better overall protection when the interval was longer than when it was shorter. So even if we had enough supply to give second doses sooner, the shortest interval we would use for this vaccine would be 12 weeks. The extension of timing for all second doses is based on current limited supply and evidence showing that this first dose offers significant protection. We are also closely monitoring the emerging evidence around timing of second doses for cancer patients and others who are severely immune compromised. We are consulting with provincial and national partners and will update Albertans if any change is made for these groups. As the Premier said earlier, we have expanded AstraZeneca eligibility for everyone aged 40 and older. I am eligible in this cohort and was pleased to join Minister Shandro this morning to receive my first dose of AstraZeneca vaccine. As I've said before, this vaccine is a good choice. In a time when exposure risk is rising sharply, the benefits of protection for anyone in this age group far outweigh the small risk of a rare blood clot. With cases rising, getting immunized is the best way to protect your health and the health of those around you. There are now 3 vaccines being offered at sites around the province, and I know that some people may wonder if this means they can choose their vaccine. As I've said, all 3 vaccines are effective at preventing illness and severe illness. I encourage eligible Albertans to take the first vaccine that they are able to get. We are not making a distinction between Pfizer and Moderna vaccines, as both vaccines use the same technology and have performed identically in clinical trials and real-world effectiveness studies. AHS clinics are using one or the other of these vaccines for those currently in eligible 2C and earlier groups. So those who go to AHS clinics will not be able to choose which of the 2 vaccines they wish to receive there. The one choice that is available for Albertans who are eligible only for AstraZeneca right now is to either choose to take this vaccine now or wait for an mRNA vaccine. mRNA vaccines, the Moderna or Pfizer, would be available approximately 3 to 4 weeks from now for those aged 50 to 64, and approximately 4 to 6 weeks from now for those aged 40 to 49. It is important to consider the risks of exposure and infection in this time period and the significant risks of severe outcomes from COVID-19 in these age groups. I would like to remind Albertans that waiting for your preferred vaccine is not without risk. It leaves you without the protection of a first dose, possibly for weeks or even months. All vaccines approved for use in Canada are effective at reducing the risk of COVID-19 infection, and even more so the risks of serious outcomes that come with it. We only need to look to our long-term care homes to see the impact of getting vaccinated. Thanks to the high vaccine uptake in these locations, we have seen a dramatic decline in severe outcomes. Comparing where we were on December 30th to April 18th, the number of active cases in long-term care facilities has decreased from 776 on December 30th to just 37 on the 18th. Hospitalizations have decreased by about 93%, and the number of deaths has been reduced by 94%. That is the difference immunization makes. That is the power of vaccines. And that is why it is so important that we all get vaccinated as soon as we are eligible to offer that same protection to all Albertans. In the meantime, we need to bend the curve and drive cases down until vaccines have been administered to enough of us to offer widespread protection. We need to limit the number of in-person interactions we have every day. We need to not gather indoors. We need to wear a mask, and we need to stay home and get tested if we feel unwell. We need to stick to these tried and true habits for now in order to get through this difficult time for a better summer. Thank you, and we're happy to take questions.
We'll now go to the phone for Q&A. We'll do 2 questions each. You can either do 2 questions off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
First is Camilla DiGiuseppe with CTV. Go ahead, please.
Hey there. Good afternoon. This question, either one of you can take a shot at it. In fact, both of you can. It's, what do you think about BC's attempts to restrict travel, stopping Albertans and others visiting the province? Was Alberta consulted in advance? And is Alberta considering similar measures to prevent interprovincial travel?
Well, I have spoken to Premier Horgan about this issue several times over the past year, and we had a conversation, in fact, I think last Thursday, where he mentioned their ongoing concern about interprovincial travel. We respect the right of provincial governments to bring in their own measures, as the Atlantic provinces did in a very blunt way about a year back. I think that British Columbia has a very good point. This is not the time for non-essential travel. We have seen a number of the very contagious P1 Brazilian variant cases we know come to Alberta from travel from British Columbia. It looks like when the party was shut down in Whistler that some of it moved to some of Alberta's mountain resorts, and that is very concerning. So at the end of the day, my understanding is it's not an absolute closure of the borders like we see right now between Ontario and Quebec, but a very strong advisory, and we respect that. We don't plan on taking any additional measures at this point. We just encourage people to avoid non-essential travel at this time, and really, if we can just bend down this curve now and let the vaccines get ahead of the variants, then I am certain we'll be able to get back to regular travel in the summer. But right now, it's just not the time to do that.
Do you have a quick follow-up, Camilla?
If I may, yeah, you're touching on that, Premier. We're not exactly seeing a significant reduction in infections even after the indoor dining was closed down. Other measures were put in place. So any further restrictions are being considered to control the spread of the virus? Well,
we're going to monitor the numbers very closely over the course of the next week, because it would typically take 2 to 3 weeks for us to see a result from additional restrictions. And so what we're watching for right now is the potential increase of cases coming from Easter gatherings that might have happened a little over 2 weeks ago. And at the same time, we're watching to see if the additional public health measures have limited spread. So those are 2 things we'll be watching for very closely in the numbers over the next week or 2. What I can tell you is that while we continue to be very concerned about these high numbers, 1,400 cases a day at this point, the rate of growth seems to have come down a little bit. So it's too early to take that to the bank. We really, the timing is so critical right now. We now have a quarter of adult Albertans vaccinated. we figure about 10% of the population has some kind of natural protection through having prior infection. And so we're by 2 to 3 weeks from now, we're going to start to see a very significant number of Albertans with some protection. The most important thing there is because we've prioritized the most vulnerable in the vaccine rollout, we hopefully will see a shrinking percentage of people who get infected ending up in hospital. But it's still very critical. All we need to do is look at what's happening in Ontario. That is real. And if we don't all be careful, that could potentially happen in Alberta. So I would just implore people, please follow the public health measures so we don't have to bring in additional restrictions and so that we can let the vaccines get the march on the variants.
Operator, can you please put through our next caller?
Next is Julia Wong, Global News. Go ahead, Julia.
Hi, just to follow up on that question, and this is for the Premier and Dr. Hinshaw. Premier, you said that typically it takes 2 to 3 weeks to see results from additional restrictions that have been brought in. But Dr. Hinshaw, you said last Tuesday that we need to watch the coming 7 to 10 days, saying that we cannot wait 3 weeks before acting. So wanted to get a sense of how long you're willing to wait before potentially introducing more measures.
Well, once again, we are going to closely monitor the incoming numbers this week. Every Monday morning, the Emergency Management Cabinet Committee, which deals with COVID and the pandemic, receives a comprehensive update from Dr. Hinshaw's team and the Minister of Health. And we discuss obviously we typically meet more than once a week, but each Monday morning we do an assessment of the prior week's data and take on board where we're at. So we're going to wait and see how this week unfolds. We are very concerned with continued high new case numbers. We are now edging towards 20,000 total active cases. And that is why it's so critically important for Albertans to just watch what's happening in Ontario. Let's all pull together. Whatever we think about COVID or about politics or whatever part of the province we live in, how old we are, whatever we do, let's unite in this last stretch. We're at the 10-yard line. And if we just hold it together, avoid the kind of social contact that spreads the virus from one to many, then we can get through the next 3 or 4 weeks, and the vaccines will start to have a real impact on the broader population. So again, we'll review the data next Monday morning. But at this point, it's a time of it's a very dynamic moment in the pandemic because you have not just those new daily case numbers, but you have the protective effect of the vaccines, particularly amongst the vulnerable. And the weather is turning in our favor to get people outside more. So a lot of things for us to track, and we'll be reviewing that next Monday. Doctor, did you want to add on to that?
The only thing I would add is that when I mentioned last Thursday, I believe that we were potentially looking at the next 7 to 10 days. We have, in fact, implemented a few additional targeted measures to align with the operational challenges that some schools were experiencing. So as I mentioned, Fort McMurray, and as I believe others know in Calgary, where school boards have gone to online learning for grades 7 to 12, we have in fact increased the restrictions on those students who are in that particular age range. So again, would just say that we are monitoring, we are making adjustments, and in fact have brought in some additional measures in a targeted way where we have been seeing some challenges in terms of rising cases.
And we're also, as I announced, rolling out 400,000 rapid test kits to schools that are most heavily affected.
Operator, can you please put through our next caller?
Next is Licia Corbella with Post Media.
Hi.
Go ahead, Licia.
Thank you. Hi, Premier. It's been almost a month since the Supreme Court ruled on the federal carbon tax. Just wondering, when it comes to the carbon tax, what are your plans with regard to that? And are you considering bringing in a plan similar to the federal Conservative Party's recent carbon tax reduction plan?
Well, we continue to be opposed to carbon taxes because we think they just punish people for living normal lives, for filling up their gas tank and for heating their homes. We don't think that's an effective environmental policy. Our focus has been on technological changes that can really make a big difference in reducing industrial emissions, and that's why we have implemented our promised technology innovations and emissions reduction program, which this year is providing well over, $750 million in funding in green technology, partly to help ensure a future for our energy industry while reducing its carbon footprint. We are also working with the federal government and the energy sector on a massive upscaling of technology like carbon capture, utilization, and storage. We were happy to see some commitment in yesterday's federal budget to incentives to expand critical CCUS technology. But with respect to the retail carbon tax, we regret that we did not win the Supreme Court reference, and as I've said, we are going to launch consultations with Albertans to hear what they want us to do. Our goal ultimately will be whatever policy imposes the lowest cost on Albertans. And there's a lot of options out there, Alicia. Some of the Atlantic provinces were allowed effectively to rebrand their gas excise tax as a carbon tax. I will note that in 2014-15, under Mr. Prentice's government, Alberta did raise its excise tax, so perhaps we could get credit for that in the same way New Brunswick did retrospectively. I'll note that next to New Brunswick and Quebec, they have a cap and trade scheme, which the federal government has deemed as being compliant with their policy, and that has an effective price of about $20 a ton, as opposed to the $40 a ton for the carbon tax, now headed to $170. So it's half as expensive, and so that's an option that we are also studying. Another alternative would be to expand the tier program, and another alternative would be just to leave the current policy that's in place. One thing I guarantee you we will not do is what the previous government did in Alberta, the NDP government, which is to use the carbon tax as an excuse to grab money out of people's pockets. They were spending 40% of that money was being wasted on things like low-flow shower heads. The other 60% was being kept by the government, and we're not going to do that. So one way or another, we're going to try to minimize the cost.
Alicia, do you have a follow-up?
Yeah, I do. It's kind of a different topic. But,
sure.
So the federal government is announced yesterday in the federal budget, that they're spending $30 billion over the next 5 years on daycare spaces and trying to make daycare cheaper. Is Alberta responding to that? Will you be putting up 50% of the cost to facilitate that?
Well, first, we absolutely recognize that many parents are struggling with the burden of childcare and work, that the cost of childcare, availability of spaces is a serious challenge for so many working parents, and we hear them, and that's one of the reasons that we've expanded support in a focused way for lower income families who are carrying the biggest burden. Secondly, when it comes to childcare subsidies, we believe that any program should respect the choices that parents make for what's best for their own families. And our first read of the federal policy announced yesterday is that it is only for a kind of cookie cutter 9-to-5 urban government and union run institutional daycare options, which excludes the vast majority of parents, parents who have shift work, who can't use that kind of care, rural parents who don't have access to it, Indigenous communities that typically don't have the capacity, the population capacity for that kind of institutional daycare. and the hundreds of thousands of Alberta families who use a mixture of different solutions, including informal care, and the other thing is the federal policy apparently excludes participation from childcare businesses who operate as for-profits. They're a critical part of the childcare infrastructure here in Alberta. And then, of course, there are the parents who make the sacrifice to give up a second income, to have a dad or mom help to raise kids at home, spending more time with their younger children. Those are choices that need to be recognized too. I've never thought it's fair to tax some parents who, for example, make that sacrificial choice in order to subsidize only one kind of care, which excludes many rural families, as I say, shift workers, many Indigenous people, and many families who have informal arrangements. So whatever it is, we will be pushing, I hope with other provinces, for maximum flexibility. But I'll tell you what, if it's a take it or leave it, Ottawa-style cookie-cutter program, I don't think that satisfies the demands or expectations of Albertans.
Operator, can you please put through our next caller?
Next is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, thanks for taking my question. I'm hoping to hear from both the Premier and Dr. Hinshaw if I can. We are hearing from a number of Alberta pharmacies that are on the provincial list as providers of Astrazeneca who simply don't have stock, or they had very little, despite being announced as part of the rollout for the 40-plus age group today. So, folks are either being put on wait lists or we're hearing about cancellations. So I'm wondering why these pharmacies are without stock, basically as this age rollout begins. And if there wasn't enough supply, why were the pharmacies included in the province's plan to vaccinate this age group with Astrazeneca?
Well, I'll start. Perhaps Dr. Hinshaw could add on to this. First of all, we worked very closely with the Pharmacy Association and the different chains that represent a lot of independent pharmacies to have them partner with us on the vaccine rollout. We now have 1,300 plus local pharmacies that are participating in it, and we've been doing our level best to provide them with adequate supply. The truth is that many pharmacies have been carrying a surplus of AstraZeneca doses because of the lack of demand, which should be corrected with yesterday's broadening of the age category. So the primary challenge with AstraZeneca to date has been demand and not supply. I expect that will change very quickly over the next week or so, as I said in my statement, as demand catches up. But I guess I would say this, when you're dealing with hundreds of thousands of doses, 2.3 million people who are eligible, a hugely diverse province, and 1,300 pharmacies, plus AHS delivery, plus First Nations administration, and so on. It's extraordinarily complex, and I can imagine in that complexity that maybe some pharmacies don't have adequate supply. But I know that that AHS will work to address any problems like that. Dr. Hinshaw?
I think that covers it. Thank you, Premier.
And did you have a quick follow-up, Jennifer?
Sure, thanks. I'm just wondering, I know you mentioned, Premier, about the opening of further walk-in clinics in other places around the province. Has there been any decision anywhere within government to prioritize AstraZeneca doses for those clinics, perhaps over pharmacies?
No, it's not choosing one or the other. It's both and we're just trying to make the vaccines as convenient and available as we possibly can. The difference between AstraZeneca and Pfizer Moderna is simply the broader age category. So we want to make sure that people 40 and up across the province can get access to what AstraZeneca doses we have, I'm going to trust the judgment of AHS, which hour by hour and day by day is tracking demand and the inventory to try to match the two. And I think they're doing a good job of it. So at one point, what do we have? Over 1.1 million people who have received their first jab to date. And I expect that with the broadening of the age category, we'll be running down the inventory pretty sharply in the next few days.
All right, we have time for 2 more. Operator, can you please put through our next caller?
Next is Deena Hinshaw with CBC News. Go ahead, Deena.
Hi, thanks for taking my question. I'm hoping to hear from both the Premier and Dr. Hinshaw if I can.
Next is Chris Bartow with the Calgary Herald. Go ahead, Chris.
Hi, this is a question for the Premier. Premier, you talked a little bit earlier about the federal budget. I'm wondering what you think about the federal government not going ahead with enhanced oil recovery being included under the carbon capture, utilization, and storage tax credit that was announced.
Yeah. Thanks, Chris. We were very concerned and disappointed. First of all, we're happy to see at least some commitment to supporting carbon capture and storage technology. If the federal government, as I've said before, if the federal government has any serious commitment to achieving their ambitious goals for emission reductions, they absolutely have to help us make carbon capture and storage a mainstay of Canada's climate policy. They are committing in the budget to expansion of CCS to reduce, to support the reduction of 15 megatons of CO2 emissions. And text. The Quest facility reduces about 1 megaton, at a cost of about $1.35 billion operating cost. So if they, based on the current costs, at least at the Quest facility, we estimate that if they want to achieve that 15 megaton reduction target through CCS or CCUS, require an investment of at least $20 billion. Now, apparently the budget talks about a credit in the range of, well, excuse me, they don't specify this, but our Environment Department has calculated, they've estimated that the federal credit would be at about a 30% rate. We would point out that the U.S. CCUS credit is at 50%, and there's a bill before Congress to massively expand it from there. So I hope, they've given 90 days for a consultation period to work with the provinces and the industry, and we will be making the case to them that this has to at least meet or preferably beat the United States when it comes to attracting capital into this critical technology. We were very disappointed to see this language about excluding the enhanced oil recovery, and quite frankly, we think it's contradictory, because the budget document also refers explicitly to the Alberta Carbon Trunk Line, which leads to enhanced oil recovery at net zero, by the way. That's net zero oil production. And the message we would send to the federal government is, shouldn't Canada be a beacon of net zero production of oil energy while there's a global demand for that oil, as opposed to us surrendering that market space to Russia or OPEC? So there's a lot to work on here, Chris. We appreciate the initial effort, but we will be very actively involved in the 90-day consultation period, hopefully to come up with a CCUS policy that massively expands that technology.
Chris, do you have a follow-up?
Yes, I do. Last week, Premier, you said the other thing you were looking for was money for job retraining. Did you get the money and whatever else you needed in terms of timing for you to proceed with your Jobs Now program, and when would you roll it out, and how would it look?
Thanks. Yes. So they did confirm that they've reprofiled from last fiscal year to this fiscal year $185 million in additional labor market development funding for Alberta, and we have approval in principle to do so through our pending Jobs Now program. I'll be meeting with senior ministers tomorrow to just put the finishing touches on the program, and we hope to announce it hopefully within the next week or so.
Operator, can you please put through our last caller?
Final question is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Premier. Thank you for taking my question. My first one is both in English and in French. Former Chief Medical Officer of Alberta, James Talbot, warns that Alberta's hospitals could soon be as overwhelmed as Ontario's. So given the current trajectory of COVID cases here, are you worried that Alberta will end up in the same situation soon?
Well, as I've said, we should take note of the crisis in Ontario and avoid that fate, and we can if Albertans act carefully in the next little while. Ontario went into this third wave starting at a much higher baseline of hospitalizations than we did here in Alberta. They were already very close to their maximum capacity. Thankfully, we had tied the relaxation of our public health measures over the end of winter and spring to the decline in hospitalization numbers. And so we went into the third wave with more available hospital capacity. So that's a critical difference, between Alberta and Ontario. That difference has also bought us more time to inoculate exactly the kind of people most likely to end up in hospital because of COVID. And so we have seen a slight reduction in the ratio of total active cases to COVID patients being hospitalized and to COVID patients in ICUs. I infer from that it's a reflection of having inoculated the most vulnerable, as Dr. Hinshaw talked about earlier, of course, the long-term care residents, but also the elderly and now more recently people with chronic conditions. So I believe we are in much better shape, but we cannot take it for granted, and we need to avoid at all costs that kind of situation. Now, right now, Audrey, we have we're approaching 400 people in hospital with COVID, about 100 in ICUs. So we would have to see a 5-fold increase in hospitalizations and a 4-fold increase in ICU admissions before we reached the place that Ontario is at now. So I think we can avoid that, but it's going to require a real effort by Albertans in the weeks to come. And do you want that in French?
Yes, please.
Okay, I'll try a summary. Sorry. Pour dire que, écoutez, évidemment, il faut que les Albertains soient attentifs de la situation grave en Ontario dans les hôpitaux, mais on peut le prévenir ici avec, si nous suivons les mesures de santé publique, parce que en Alberta, notre taux d'hospitalisation, en Alberta, le taux des gens en hôpitaux est beaucoup plus bas qu'en Ontario. Et maintenant, nous avons par exemple 100 personnes dans les soins intensifs. Notre capacité est plus de 400. Alors, on a beaucoup plus de capacité, mais il faut que nous soyons très prudents dans les semaines à venir.
And Audrey, do you have a quick follow-up?
Yes, just in French for this one. Dr. Hinshaw a dit la semaine passée que cette fois-ci, pour la troisième vague, on ne peut pas attendre 3 semaines pour voir si les restrictions imposées récemment fonctionnent. Il faudrait plutôt agir en 7 à 10 jours. Aujourd'hui, ça fait 11 jours environ. Donc, et les chiffres n'ont pas beaucoup descendu. Est-ce que vous considérez mettre en place des mesures plus sévères?
Pas aujourd'hui. Nous suivons de près les chiffres et nous suivons l'impact des entretiens du PAC, des réunions sociales du PAC, et nous suivons également l'impact des réglementations que nous avons imposées il y a 2 semaines. Et enfin, nous suivons l'impact des vaccins parce que c'est important. Nous voyons une diminution du nombre des personnes infectées avec COVID-19 qui vont aux hôpitaux. Alors, il y a toutes ces questions dynamiques maintenant. Lundi prochain, le Conseil des ministres va considérer, comme toujours, l'avis de Dr. Hinshaw et le ministre de Santé pour voir s'il faut prendre les actions supplémentaires.
Perfect. That concludes our time today. Have a good afternoon.
Thank you. Sir.